Testing start. Have you ever tried to have a low-grade fever and have been coughing for a week? In this case, we will see a doctor. In addition to the physical examinations, what will the doctor do? For example, will he ask you to perform a medical checkup? Will you see a doctor if you have a low-grade fever and have been coughing for a week? So what will you do? You will see a doctor. So when you see the doctor, in addition to the physical examination, what will the doctor do? What will the doctor do? And before he provides you medication, actually what should be done? And before he gave you medication, for example, drugs or some therapy, medical therapy, what should be done? Can the doctor really understand? Can the doctor really know? Can the doctor really make diagnosis before performing some diagnostic test? So actually, there are about 70% of the clinical decisions have been made. There are about 70% medical decisions. There are about 70% of clinical decisions have been supported by lab data. So actually, there are about 70% of the clinical decisions have been supported by laboratory tests, laboratory results. So actually, have you tried having a low-grade fever and have been coughing for a week? In this case, will you see a doctor? In addition to the physical examination, what will the doctor do? And before he gives you the medicine or provides some medical therapy, and before the doctor provides you the drugs or medical therapy, and before the doctor provides you the drugs, actually what should be done? Will the doctor really understand? Will the doctor really know can the doctor make the diagnosis before performing some diagnostic tests? Actually, there are about 70% of the clinical decisions have to be supported by laboratory results. So medical laboratory science is an important and indispensable scientific discipline in the medicine field. In medicine, professor And laboratory technology. Inside medical laboratory, the professions and the profession that working in the medical laboratory are the medical laboratory technologists. MLT perform laboratory analysis to aid the detection and diagnosis of human disease and also to monitor medical treatment. To aid to detect and diagnose human diseases. Other than the diagnosis, you have to monitor the medical treatment. MLT will perform laboratory analysis to detect and diagnose of human diseases and also to monitor the medical treatment. Other than that, we also promote health and we also promote health and disease. We also promote health. We also perform risk assessment to promote health and prevent of disease. MLT perform laboratory analysis to detect and diagnose human diseases. Also, we will monitor the medical treatment to see if the treatment is suitable. Will there be any overdose or under treatment? MLT will perform laboratory analysis to detect and diagnose human diseases. We also monitor medical treatment in order to find out if the treatment is effective to cure the disease or will it be any overdose of the drugs or under treatment. Other than that, we also perform some risk assessment to promote health and prevent some disease. Actually, in the hospital, there are four. Actually, in hospitals, there is a department of pathology. Within this department, there are four main disciplines, which is anatomical pathology, chemical pathology, medical microbiology, and hematology and blood bank. I'll introduce all of these four disciplines to you. In anatomical pathology, tissue specimens will be processed and prepared into sections and smears, and the tissue structure and the cellular pathology. The tissue structure and the cellular morphology will be examined under microscope so that abnormalities can be identified. For example, cancers, diffuse pulmonary disease. For example, cancers. Firstly, physicians will take some sample from you. So firstly, tissue sample will be collected. Firstly, tissue sample will be collected and then fixed into fixative to prevent it deteriorate. To avoid tissue deterioration, and the tissue will be fixed in fixatives, and the tissue will be fixed in fixative to prevent deterioration. After processing, the tissue will be embedded into paraffin block to support it to have a very tiny to support it to be cut into a very thin layer. So the thickness of the section is around 4 micron, which is just one cell layer, which is about one cell layer. And then this tissue section will be mounted into a glass slide. After staining, we can examine the tissue section under microscope. For example, this one is a normal lung tissue. For example, this is a near normal lung tissue. You can observe there are some air sacs with the red blood cells, and inside you can see it is a normal, for example, it is a normal lung tissue. You can see this is the air sacs with some red blood cells inside. Compared to another one, which is a pulmonary aspergillosis. Compared to another slide, which is pulmonary aspergillosis, stained by silver stain and stained by silver stain. Inside the air sac, there are some infiltrated. There are lots of infiltrated cells. There are inside the air sac. It is filled with some. Inside the air sac, there are plenty of. Inside the air sac, there are lots of. Inside the air sac, they are infiltrated with. Inside the air sac, they are infiltrated with blood cells, and the fungi is demonstrated. and the fungi is clearly demonstrated in black color after staining. In chemical pathology, in chemical pathology, body fluids will be investigated for metabolic disorders and toxicology. Body fluids, including serum, urine, cerebrospinal fluid, will be investigated for metabolic disorders and toxicology. Cardiopulmonary disorder. There are thousands of biochemical tests. In these tests, the level of biomarkers will be tested by. There are plenty. There are hundreds of biochemical tests. In these tests, the level of biomarkers will be examined by chemical and the level of biomarkers will be determined by chemical and serological reactions, and the results will be compared to the reference intervals. Here are some common biomarkers. For example, for diabetes, we will test glucose. There are some common biomarkers. For example, there are some common biomarkers. To test diabetes, we will test the blood or urine glucose, blood lipids. It's useful to assess the risk of getting heart disease. Blood lipids, including cholesterol and triglycerides, are useful to assess the risk of getting cardiovascular disease. Urea and creatinine are the common biomarkers for renal function. Total protein and bilirubin are the biomarkers for liver function. For cardiopulmonary diseases, electrolytes, ABG, and troponin are the common tests. Electrolytes, arterial blood gas, and troponin. Electrolytes, arterial blood gas, and troponin are the common biomarkers. Toxicology is also a part in the chemical pathology. We will test the metabolites to investigate. We will test the metabolites by spectrometry. We will test metabolites by spectrometry. We will test metabolites to investigate. We will test metabolites by spectrometry. By spectrometry, in order to monitor therapeutic drugs. in order to monitor the in order to by spectrometry for therapeutic drug monitoring and also drugs of abuse to monitor the therapeutic drug and also assess any drugs and assess any drug of abuse cases. In hematology and blood bank, whole blood sample will be used. In hematology and blood bank, whole blood sample will be used to investigate hematology, to investigate hematological disorders, and to perform blood transfusion tests. To investigate hematological disorders and to perform blood transfusion tests. CBC complete blood counts is the major blood test in hematology. This test analyzes blood cell counts and cell size by flow cytometry, and it also measures the hemoglobin level by the spectrophotometry in order to know whether the patient is suffering from anemia. Other than that, MLT will also make some blood film and stain it. Some blood film. After staining, we can examine the blood cell morphology under microscope. For example, this is a normal blood picture. This red in color, oval in shape. This red color, this pink in color. For example, this is a normal blood picture. This round pink in color. Those pink in color, round inside. This pink color by concave in shape. This pink color by concave in shape are red cells. This pink colored round and biconcave in shape are red cells. This much bigger with nucleus inside. This larger in size with nucleus inside is a white blood cell. And the tiny little pieces over there, they are the platelets. Compared to the normal blood picture, this is a case of thalassemia. You can see the red blood cells are abnormal. They can in various shape, but not. You can see the various in shape. You can see the red blood cells are various in shape. Some are oval, some are crenulated, and some are even and not biconcave. And some are target and some are oval, some are crenulated, and some are target but not biconcave. And this case is a leukemia, and this is an abnormal, and this is a leukemia case, a kind of WBC, abnormalities, a kind of WBC abnormality. You can see in the same this is a leukemia case, a kind of WBC abnormality. You can see there are clumps of WBC with very large nucleus. So actually they are the blast cells, and this is a kind of blood cancer case. So they are the blast cells. So these cells with very large nucleus are the blood cells, and we can say that it is a blood cancer. They are the blast cells. It can be caused. It is also known as blood cancer. Other than examine the blood cells in the blood bank, MLT will perform blood grouping and transfusion tests based on antigen-antibody reaction. The tests are based on antigen-antibody reaction. For example, on top of your red cell, there are some antigens. If you are blood group A, you have A antigen, and the anti-A antibody will attach to this antigen and provide you a positive result. So we perform these kind of tests in order to give you a compatible blood products for transfusion. In medical microbiology, we will identify the microorganisms, including bacteria, fungi, parasites, and also viruses. So to identify bacteria infection, we will firstly inoculate the sample in the culture media. We will firstly inoculate the sample on culture media, and then put this media into incubator, and then incubate this, and then put the culture media into an incubator to let it grow, to let the bacteria grow overnight. In the second day, we can examine the colony morphology. In the second day, the bacteria will grow into colonies. In the second day, the bacteria will grow into visible colonies. We can examine these colony morphology and also stain the bacteria and examine under microscope to see we can examine the colony morphology and also stain it to see the microscopic morphology of the bacteria. Then we can design. So after that, we will design the performance of which we can design. Based on the morphology examination, MLT will design to do MLT will design suitable biochemical tests to confirm the bacteria identity. But after confirmation of the bacteria is not but after identifying the bacteria is not enough. Nowadays, there are lots of drug resistance. There are many drug resistance bacteria. So MLT have to perform antibiotic sensitivity test. So MLT have to perform antibiotic sensitivity test to check which antibiotics can be killed. To check which antibiotics can kill the bacteria. So MLT will perform antibiotic sensitivity test to find out which antibiotic is suitable to kill the bacteria and report it to the doctor. Other than bacteria, there are other pathogens such as fungi, parasites, and viruses. MLT will also identify all of these pathogens and report. MLT will identify these MLT will perform tests to identify these pathogens. MLT will also perform tests to identify these pathogens and also perform the drug susceptibility test and report to the doctor. Other than the 4 disciplines, there is a new branch of clinical lab called molecular diagnostics. It is a kind of In this branch, the laboratory tests are interrelated. In this branch, the laboratory tests the lab tests are interrelated to the other 4 main disciplines. The tests are used to predict and diagnose diseases based on studying the nucleic acids, that means the DNA and RNA, and protein biosynthesis. Molecular tests can be used to detect infectious diseases, for example, influenza A, tuberculosis, in a much faster way, and molecular tests can be used to detect infectious diseases, for example, influenza A and tuberculosis in a much faster way than the traditional. In a much faster way when compared to the di- traditional diagnostic tests. It can also use to diagnose genetic diseases, for example, Down syndrome, to provide it can also diagnose it can also use to diagnose genetic diseases, for example, Down syndrome. In the old days, we have to test the embryonic fluid So we have to molecular tests can also to diagnose molecular tests can also use to diagnose genetic disease, such as Down. Molecular tests can also use to diagnose genetic disease. For example, to diagnose genetic diseases such as Down syndrome. It is commonly that the pregnant women have to undergo. It is common that the pregnant women. It is common that pregnant women have to undergo amniocentesis or chorionic villi sampling to test some biomarkers. To test some biomarkers inside the fluid. To confirm diagnosis of can also help to diagnose genetic diseases, for example, Down syndrome. The pregnant women have to undergo amniocentesis and chorionic villus sampling to confirm if the fetus is suffering from Down syndrome. So actually it is a kind invasive case. It is a kind of invasive test. If we use molecular, but now we can use molecular tests to detect the fetus DNA through mother's blood. But now we can perform molecular tests to detect the fetus DNA through mother's blood. It is accurate. The results are accurate and much less invasive. In molecular as you know, there are many targeted therapy. Molecular studies also aid to target therapy. To detect a particular mutation, to detect a particular gene mutation, in the cancer, the doctor in order to test a particular gene mutation, the doctor can decide to use targeted therapy. The doctor can design a suitable targeted therapy for the cancer patient. Other than disease diagnosis, molecular tests can also predict the risk of a disease. Molecular tests can also predict the risk of getting a disease. For example, BRCA mutation. For example, there are some study to prove BRCA gene mutation can increase the risk in breast and ovarian cancer. So if a patient have the family history of breast or ovarian cancer, and she also find that there is a BRCA mutation, the doctor may if a if a girl have a family history of breast or ovarian cancer, and she have a high and she found that and she also has BRCA mutation. She has much higher risk of getting the breast or ovarian cancer, so she have to do some prevention or based on the doctor's suggestion to prevent the development of cancer. So in this MOOC lecture, in this MOOC, in this clip, in this lesson, you should know there are 3 applications of medical laboratory tests, including to detect and diagnose human diseases, to monitor the medical treatments, and also we will assess the risk of disease. In the Department of Pathology, there are 4 main disciplines plus 1 special discipline, which include anatomical pathology, chemical pathology, hematology and blood bank, medical microbiology, and finally the molecular diagnostics. Before you go, please think about there are many different laboratory tests, and these tests require distinctive human samples. What is the proper way to collect these samples? Any special container should be used? And after collected, how to store it? After collected, how to store these samples? Will the storage condition affect sample integrity? And what will happen if the sample integrity is lost? See you in the next lesson. Bye.